Today we'll be talking about interviewing colleagues about what evidence-based practice is. I interviewed 7 of my nursing colleagues. 2 were staff nurses, 2 were nurse managers, a nurse educator, a device company nurse, and a nurse practitioner. They were asked to define evidence-based nursing. One said nursing by data collected on research. Another, documentation backs evidence to do nursing practice. Nursing that has quality of care. Where you do your nursing job based on what works, evidence to support it. Having evidence to base care that you give to patients. Based on proven documents of nursing care. Treatment and medical procedures based on other studies, hospital research. Looking at the definition of what it is, evidence-based practice and evidence-based decision-making is based on external evidence, systematic reviews, randomized controlled trials, best practice, and clinical practice guidelines that support a change in clinical practice, internal evidence, healthcare providers' expertise, quality improvement projects, outcome management initiatives. For the patient, preferences. What does the patient really want when we give them several different options? Patient values. What is their quality of life? Next, my colleagues were asked how they utilize evidence-based practice in daily practice. It said standards of care or patient care, Foley care, keeping the Foley below the bed, daily cleaning, tape to the leg, pain management and its follow-up, hygiene, doing IV starts and utilizing sterile technique to prevent infections, patient's blood pressure, hypertensive, evidence to call the MD to treat, doing a TE prior to PVI ablation when the INR is out of range or due to the rhythm, or core measures for heart failure medicines to use. The colleagues were also asked, were there any barriers for them to use evidence-based practice? One said physician orders and hospital policy. One said none. Another said they were limited by policies that maintain old standards. One said I don't have any, but I do things the way I was taught. Some hospital protocols. One said nurses that have been here forever and do things the old way and not by new policies. One said MDs who do things their way or by their preference. That is not the proper path in care. Contemplating a task I do during a clinical day and what evidence could be used as the foundation for this task is what I do based on research, or is it personal preference, clinical guidelines, or traditions. During our day, we usually do device implants in the EP lab. We give an IV antibiotic. Usually this is done, or always done prior to the incision and documented, and this is a core measure. Our hospital protocol is if we give ANSEF, we give it within a 30-minute window prior to the incision. If we give vancomycin, it's given within a 60-minute window prior to incision. National standards that apply to this are CMS studies and a 2013 guidelines from the American Society of Health System and Pharmacists, Infectious Disease Society of America, Surgical Infection Society, and the Society of Healthcare Epidemiology of America. Evidence-based practice as a nurse. It is our goal in improving practice as a nurse and improving outcomes for the patient, and that's the bottom line. Thank you.